Mental health and LGBTQ plus youth. So my population will be mental health and LGBTQ plus youth. The Trevor Project conducted a 2024 national survey on LGBTQ plus youth, and it showed that more than 1 in 10 youth people attempted suicide in the past year. 50% of youth who wanted mental health care in the past were not able to receive it, and 54% of transgender and non-binary youth found their school to be gender affirming, which lowered rates of attempting suicide. So why this community? So, in terms of my future career, I do plan on working with adolescents, and I will be working with people who are at the beginning of their transition, in the process of their transition, and ending their transition. And it's important for me to stay competent and stay educated on the LGBTQ plus community, whether it's working with transgender youth, or sexuality in youth. So, I just need to make sure that I'm staying competent and I'm keeping an open mind as to things will be constantly updating and changing in this community, as for all other communities. As for my personal experience, my best friend transitioned when we were about 13, 14 years old. And I have permission to talk about this, so he gave me permission. In his early childhood, he was able to freely express himself, but due to societal norms, he found himself wanting to fit in with girls, which created a severe amount of uncomfortability for him, and it made him feel torn inside. This resulted in him acting out and experiencing severe depression. And at this time, he was unable to understand why he was feeling this way. As he progressed towards middle school, he experienced constant bullying to the point where in ninth grade, he was physically assaulted in a school bathroom. And this situation alone spiked his depression, and his feeling of being alone became much, much worse. Around the age, sorry, around the age of 14, he was able to attend a social event that had a lot of transgender creators, and he actually met a famous trans man who, for the first time, helped him feel not alone. He felt confident in his body. He gained hope and realized that he has a good support system. He has a community to be involved with and to feel supported and loved and respected. And this gave him a better understanding of how there was a lack of support in his school setting. And he wished that the school counselors and staff could be more trained consistently and given proper resources to be able to help kids that are in similar situations as him, creating that safe space to go and be connected to people. So, as we're able to demonstrate cultural humility and address the power dynamics, it's important to center the voices of LGBTQ plus youth. Um, Although we're using data to speak up for this youth in this community, we're not speaking for them. We just want to be able to make sure that we're making their voices louder when we're advocating for them. It's important for us to recognize intersectionality and acknowledging that the layered experiences of LGBTQ plus communities also face racism, ableism, poverty, and even immigration challenges. For example, my best friend, he was in the process of transitioning, and he is also a person of color. And obviously that experience is very different than someone who is in the process of transitioning who is a white person. So it's important that we're recognizing or acknowledging those layered experiences and reflecting on those diverse subgroups. Um, as we're continuing to advocate and work with vulnerable communities, it's important to stay competent as we remain open to being corrected and learning about the LGBTQ plus community and their members and making sure that we're incorporating a lot of trainings on issues, history, and cultural practices in this community. As we're making the effort to stay competent, we want to make sure that we're using data responsibly. We are presenting the data that we're given in ways that are respectful, and we're respecting the dignity of the people that we're representing, which also ties into respect. And we want to make sure that we're equally distributing resources. So we're ensuring that the funding, the services, and the programs are reached out to the most marginalized groups within the LGBTQ plus community. And we're making sure that we're prioritizing funding. Um, we must challenge institutional power. It's important for us to advocate for policy changes, and um, we're using data in a respectful and correct way to push back on the stigma or the disrespect that these communities are experiencing. And as we're working on recognizing intersectionality, staying competent, centering the voices, we want to make sure that we're increasing our level of empathy. We're staying competent and also increasing our empathy with the people that we're working with the groups that we're working with, which also relates to increasing our self-awareness, understanding biases that we may have, and then also maintaining respect. We must respect the people that we're working with. We should respect um, their decision making and their dignity, and making sure that we're loving our clients and we're passionate about working and advocating for them. So the scholarly overview pretty much just shows that there is a significant association between anti-LGBTQ plus and high rates of suicide risk. Um, the Trevor Project pretty much just emphasizes that safe school environments improve outcomes for youth that have reported being suicidal. So what can we do? So we want to make sure that we're providing better training for school counselors and staff. An example could be a district-wide LGBTQ plus competency training program for school counselors, staff, and even parents. And we're making sure that we're um, creating safe spaces in schools for this youth, this community, and a community-based intervention could be in a peer support group or affirming school policies and gay straight alliance clubs. And we want to make sure that we're constantly making an effort to educate our communities and advocate for them and build that stronger connection to community support and resources. As we're seeing bills across the country that attempt to ban gender affirming care, limit access to health care, such as the One Big Beautiful Bill Act, when it's proven that trans youth who have access to gender affirming care in a supportive environment are far more likely to experience improved mental health, self-esteem, and overall life satisfaction. And the Trevor Project, it states that 90% of LGBTQ plus youth people said their well-being was negatively impacted due to recent politics. It's important for us to recognize that the well-being of trans youth is serious. And we must protect these children. We must provide them with the care and understanding they need, and that saves lives. And the simple act of affirming a young person's gender identity, whether it's through supportive parents, friends, school setting, or healthcare, can greatly reduce these risks of suicide and mental health issues. Obviously, as we advocate, we're going to face many challenges, such as political backlash and lack of support or funding from school leadership programs or any school programs. Solutions to these challenges could be seeking grants from external resources and involving students, parents, and the community that we're in for advocacy for the LGBTQ plus youth community. And to conclude, it is crucial to support and empower young minds during these times to help them heal and to find their true selves and understand that they're worthy of love and respect. So let us work together to create a world where every child, regardless of their gender identity, can thrive in a safe space, an affirming space, and a compassionate space. Thank you.